Hey everyone, I am Dr. Caleb Kaufman with NorCal Physiotherapy and Sports Sciences. Today we're going to be talking about exercises for swelling and inflammation. Specifically, we're going to use an example of ankle sprains. So before you say anything, no, swelling and inflammation is not a bad thing. That's just part of the normal healing process. When inflammation and swelling gets out of control and out of hand, yes, that is bad. We're not going to talk about that. We're talking about that initial phase of swelling and inflammation. So what we're going to do is look at the ankle, like I said. So what we want is, we want to look at the body. So what we're going to say is this is the legs and the feet and the ankle. Fantastic drawing, I know, but don't try to copy it. So what we're doing is thinking of ankle sprain right in there. As we get a sprain, as we get an injury, the body wants to heal as fast as possible. So what it does is it starts flooding that area with healing products. So what we have is we have injury, then we have healing. It goes into that injured area, okay? So as more blood, more fluid goes into that area, obviously you're going to start getting swelling right in there. If there's traffic going one way and no traffic going the other way, there's going to be a backup. Same thing with blood. If we don't have the waste products going out, everything is just going to stay right here. So that means we have to get this out. The first thought is always jump to rest, ice, compress, and elevate. What we're finding actually is that is not the best thing to do after injury. Ice actually can slow down healing. Rest is going to cause stagnation of the blood flow. So what we want to do is encourage the fluid, the blood, the waste products to pump back up the leg so that it can go back into the circulation system or be disposed of. The problem with this area is that it's so far down, the blood pressure is super low, the gravity is higher, it's harder to pump it out because of those two things. So the heart isn't able to push the blood back up. And I recently heard something that was really interesting and really cool. They said the calf muscles are the heart of the lower legs. And to a certain degree, that is the most amazing thing I've ever heard, because the purpose of the calf muscles, one of the main purposes, is to help pump the blood back up. So what we have, if we look close, and another fantastic drawing is coming up, if you think about the blood vessels like this, there's no muscles in there's very little muscle in the veins, and there's very little blood pressure. So how does the blood get back up and resist gravity? Well, the calf and the muscles in the lower leg start to push, and they make a mechanical pump so that the blood can start going up. And every once in a while, there's a one-way valve so the fluid cannot return back down. So as it goes up, squeeze, push up, squeeze, push up. So based on that, this rudimentary drawing and this very basic explanation, the best way to get healing in to the injury and to pump the waste product out is going to be to activate the muscles around the area of pain and the area of injury. Now, throughout this, we want to be very careful not to overdo it, because yes, it is an injury. It is pain. There is harm done here. So we don't want to overactivate something that's already angry. So what we do, if your ankle hurts too much, what we do is we move the feet and the calves and the knees. If you can move the ankle, do that. If not, you just avoid it and work the area around it, because really what we want is we want the blood to come from here, go up, and go up. So as we squeeze and it goes up, what we can do is relieve the pressure, relieve the fluid amount in there, and try to restore this normal hemodynamics. So what we're going to go over is a couple exercises to look at that. And just remember, even though we're using the example of an ankle sprain, this can be used for any part of the body. If you have a wrist sprain, if you have an elbow strain, if you have anything going on, use these exercises but modify them for that part of the body. Now, as a caveat, be careful, don't overdo it. If you have a sprain or a strain, go get checked out. Don't automatically just jump to this stuff. This is great after you've been assessed, or if it's just a low-level swelling that you get. So let's go through those exercises and see what we can do to help you out. So the exercise that we're going to be going over are very, very simple and basic. All it is movement. We don't want any resistance. We don't want any weight bearing. All we want to do for now in the first stage is just get some movement. Simple is better, because people actually do simple, and because simple is easy to replicate. So we're going to go through a couple different exercises Very simple, very easy, but make sure you do these within your tolerance. Just because it's easy doesn't mean you need to push and push and push. Start easy and then progress as you can. And I'm going to hop up on the table so it's a little bit easier to see what's going on. So again, looking at the example of an ankle sprain. First exercise, easy. All you're doing is toe curls. Close as hard as you can, open as wide as you can. So it's not about how many you can do, it's not about how fast you can go, but try to get as hard of a contraction as you can tolerate and as it doesn't have pain. Exercise number 2. So we did the feet. Now let's move up to the ankle. Ankle pumps, pushing down, try to activate the calf, pulling up, try to activate the muscles in the shin. Again, full range of motion, nice big contractions. All right, so moving up a little bit, what we're going to do is rotation. You should feel this over here. You should feel this over here. So making big circles one way, and then big circles the other way. Now we're going to keep working up. We did the feet, we did the ankles. Now let's do the knees. Straighten the knee out, get the quad activated, bend the knee back, try to get the hamstring working. All right, so once you get good at those, you can progress. Think about the ankles. We did the ankle pumps. Now all you're going to do is just calf raises, pushing up, and then bringing the toes up. All right, very basic exercises to get you started. Movement is good. We don't want to overdo it. We want to be able to allow the tissue to heal, decrease the strain on it, but also encourage the normal hemodynamics, the normal blood flow to resume. So remember, if you have an injury that needs to be assessed, go get that checked out first. If you have chronic swelling, go get that checked out. A lot of times swelling is a sign of something deeper, something else going absolutely terribly wrong. So don't just assume that swelling is there for no reason. There's always a reason that it's there. So make sure you get that checked out. Make sure you know what you're doing before you just all of a sudden do exercises for swelling and inflammation. Get the feet moving, get the ankle moving, get the calf moving. Try to get that blood flow moving as much as you can. Remember, the calf is the heart of the lower legs to a certain extent. It helps with blood flow. It's a good pump to get everything shooting back up the leg. So this should not be a replacement to see your physical therapist, to see your medical doctor, to see your osteopath, because we want to make sure that what we're trying to treat is actually being treated.